Hello, everyone, and welcome to this audio podcast. In this series, The Pathology Storm, this is an audio podcast series in line with the Shientist Chartered Edition. It's a Storm Robotics production in collaboration with the Renal Patient Support Group, the RPSG. And today I'm going to provide an overview in part with the previous audio podcast in line with previous audio podcasts that relate to a peer review manuscript that has been invited in towards a book chapter. The works will be available through the Renal Patient Support Group, the RPSG. However, in line with sharing a little understanding around this subject, I'm going to provide an understanding of the Renin angiotensin aldosterone system and the RAAS pathway and the role of ACE2 during COVID-19. So the renin angiotensin aldosterone system is a multi-hormonal regulator, of blood volume and systemic vascular resistance. Angiotensin is cleaved by renin, forming inactive decapeptide angiotensin I, which is next converted by angiotensin-converting enzyme into active octapeptide angiotensin II. The binding of Ang2, so the abbreviation for angiotensin II is Ang2, Ang2. So the binding of Ang2 with adequate angiotensin receptor AT1 or AT2 leads to hypertension, inflammation, and multi-organ failure. So works by several authors have highlighted the common and potential antiviral drugs or treatments. However, before these ACE2 had been available to prompt blood flow between renal afferent and efferent arterioles, thus oxygenating cells throughout general physiology. ACE2 performs a more protective role by degrading Ang2 to active peptide Ang1 1 to 7 through cleavage of carboxy terminal phenylalanine in Ang2. So products of ACE2 action binds with mitochondria assembly protein 1 or MAP1 receptor, leading to vasodilation, vasoprotection, and cardioprotection, showing regulatory roles of both receptors. However, ACE2 receptors are inhibited during SARS-CoV-2, which downregulates protective action and leads to severe development of COVID-19 by hypercoagulation and microangiopathy. The infected cells are forced to translate proteins required by generating the virus's progeny, which also provokes immune action. So in line with this, there is an illustration in the peer review manuscript that relates to the visualization of molecular action undergoing differentiation during COVID-19 infection. In this podcast, this audio podcast, I'm not going to highlight the illustration in any particular detail. However, the visualization of molecular action undergoing differentiation during COVID-19 involves is where the SARS-CoV binds binds to ACE2, which not only leads to its entry but also irregular balance between A and G molecules, resulting in the severity of the disease. ACE2 are also pharmacologically related to angiotensin receptor blockers, or ARBs, and ARBs are inhibitors that dilate blood vessels to treat conditions such as hypertension. So in line with this, innate immune cells and macrophages sense the presence of pathogens and are involved to present viral antigens to T helper cells, which release interleukin 12 to trigger Th1 cells. Subsequently, Th1 stimulate B cells to produce antigen-specific antibodies and T killer cells. T killer cells are specific in this context specifically are CD8 and TK to target cells containing viral antigen. Using the nuclear factor kappa light chain enhancer of activated B cells, NFKB, signaling pathway pro-T cell activates inflammatory cytokine production, secreting chemokine and cytokines, for example, or like interleukin 8, TNF alpha, tumor necrosis factor alpha, interleukin 6, interleukin 1 beta, and CCL2, which is a C2C motif chemokine ligand 2, 3, and 5. And accumulation of immune proteins creates what is known and has been highlighted through several publications and literature as known as creates a cytokine storm, which leads to tissue damage, resulting in multi-organ failure and death. So the limitations related to post-mortem examinations of the kidney cells present ambiguities of the cytokine storm concept, but what is known, there is development of acute kidney injury, or AKI. However, the early COVID-19 cases presented involvement of the cytokine storm mainly through interleukin 6, which induces renal endothelial cells to prompt pro-inflammatory chemokines and cytokines. So in line with that as well, is the process of during a cytokine storm. During a cytokine storm might cause severe effects like microcirculatory dysfunction, capillary leaking syndrome, and production of thrombosis. This results in disseminated intravascular coagulation, epithelial or tissue damage, and/or apoptosis. Additionally, sepsis might be a lethal factor in COVID-19 patients due to general weakness of the body after a cytokine storm. Within damaged organs, overload of endotoxin leads to septic shock, which induces acute kidney injury and kidney damage. Works by several authors go into more microscopic detail relating ACE1 and ACE2 gene polymorphisms. So in the next audio podcast, I'm going to be talking about a bit more depth surrounding the immunobiology and the complement system in regards to COVID-19. And so this ends this audio podcast around this particular this particular focus around understanding renin, angiotensin, aldosterone system, and the RAAS pathway for the role of ACE2 during COVID-19. This has been a series around the pathology storm. This has been the Shientist and a storm logistics production in collaboration with the Renal Patient Support Group. Thank you for taking the time to tune in.